Osteotech is the world's leading processor of allograft bone tissue. As a global leader in musculoskeletal science, Osteotech is committed to innovation in the development, manufacturing, and marketing of biologic, biomaterial, and device systems for musculoskeletal surgery. To ensure absolute safety and integrity of each and every product we make, all donor tissues are processed following a rigorous and comprehensive series of manufacturing and testing procedures. Beginning the very moment the donor is procured, each phase of production and packaging adds another layer of safety and product integrity. Upon receipt of the donor, the box is opened and inspected to ensure the shipment is complete and correct. Each piece is checked for package integrity. Ripped or torn bags or bags with bleed-through are not acceptable. Once the visual assessment has been made, the technician documents the order, making any comments related to the quality of the packaging. The pieces are double-bagged and a quarantine sticker is applied. They will be kept quarantined in a freezer until final approval from quality assurance is given to process them. A barcode is applied to the outermost bag, which will be used to track the donor by location throughout the process. The barcode on the bag is scanned, as well as the freezer identification number. Freezer temperature is maintained at -60 degrees Celsius or colder. Prior to donor release from quarantine and being made available for processing, a quality assurance technician reviews all donor paperwork once again to ensure absolute accuracy. Before entering the core to begin processing tissue, the technician scrubs his arms and hands following proper aseptic technique. Now he begins the gowning process, putting on his gloves, arm covers, protective headwear, gown, boots, and eyewear, following proper sterile technique. A second pair of surgical gloves are worn for added protection. Fully suited, the technician is now ready to enter the tissue processing room. The soft tissue process begins with the removal of extraneous tissues, such as fat and muscle, as well as the removal and preparation of ligaments, tendons, and other major soft tissues that can be utilized for transplantation. Note that the hard tissue byproducts are saved and will be processed separately during the hard tissue processing stage. For this case, the processing technician starts out by removing the semitendinosus and gracilis tendons, which will be processed separately. Here, the patella ligament is dissected by cutting down to the synovial pocket, being careful not to remove any of the attachment site of the ligament. The tibial tuberosity is removed, comprising the second part of the bone-tendon-bone transplantation. The one bone is the patella itself. The other bone block is the greater tuberosity of the tibia, with the patella ligament spanning the distance between the two. Osteotech processes all of the major soft tissues for transplantation, including the patella ligament, the fascia lata, the Achilles tendon, semitendinosus, the gracilis, the posterior tibialis, the anterior tibialis, pericardium, rotator cuffs, and costal cartilage. The technician is now using an osteotome to free up the inner part of the tibial bone block. Basically, the bone blocks we provide are much larger than what is actually used. This allows the surgeon to shape it whichever way he wants. Here we see the technician squaring off the bone block with an oscillating saw to give a neat, uniform appearance, taking care not to cut into the actual attachment of the tendon. He also uses scissors to do some fine-tuning, squaring off the edges of the tendon bone block attachment. The technician has just completed the bone-tendon-bone graft. The tibia will join the remaining bone tissues once the remainder of soft tissue processing is complete. The piece being processed here is the Achilles tendon. Once again, the technician uses an oscillating saw to cut the bone block from the calcaneus. All new employees attend an intensive 2-week training program prior to entering the Corps. They then complete a comprehensive hands-on training program side by side with an experienced technician. After 2 months of training, the technician is given a written test, which they must pass in order to continue training. At the conclusion of 6 months of training, a written and a practical examination will be conducted. The technician must pass both exams to continue as a processing technician. Periodic visual exams will be conducted by the facilitators of each module for another 6 months to ensure absolute proficiency. Excess tissue is carefully scraped from the front and back of the tendon using a blunt osteotome so as not to put any nicks or cuts in the tissue. Fine-tuning is accomplished with scissors to trim the sides of the tendon, resulting in a clean, squared-off appearance along the edges. The technician alternates between using the oscillating saw and scissors to square off the bone block, removing a little at a time until it is of proper usable size. Similarly, we process a number of different tendons, including the gracilis seen here. The finished tendon is measured to ensure its length falls within required specifications for this particular order. Here we have a technician processing a fasciolata, which is the lining of the quadriceps or thigh muscles. There is a large amount of fat and extraneous tissue associated with the fasciolata, which are removed using a blunt osteotome. There are many uses for the fasciolata, the most common being as bladder slings, hand tendons, and even patches for heart surgery. Using a scalpel, the technician cuts off the usable portion of the tissue, trying to get the largest piece possible, as it will require further scraping, cutting, and fine-tuning. The edges are squared off using a scalpel, and more fat is removed with a blunt osteotome, resulting in a clean, neat, rectangular piece of usable tissue. Here we see the resultant pieces of soft tissue processed from this donor: 2 fasciolatas, 2 Achilles tendons with bone blocks, 2 gracilis tendons, and 2 bone tendon bone pieces. Before the processed tissues are packaged, the technician will lavage or wash all the marrow and lipids from the bone blocks to remove as much of the residual antibiotics as possible. The whiter, cleaner tissue on the left is the lavaged tissue, and the one on the right with a pink appearance has not yet been lavaged. Now he's taking a small sample of the tissue and preparing it for destructive testing. This entails placing a tissue sample into 2 different types of media. One which allows for any kind of aerobic organisms to grow, and another for anaerobic culture, which tests for organisms that grow in an oxygen-free environment. The processing technician takes measurements for each piece, speaks them aloud to his partner, who repeats the measurements to confirm they are correct, and records them in the processing log. After each piece is measured, it will be swabbed front and back and wrapped in particulate-free gauze, ready to be placed in its final package with the exact donor number and serial number on the package itself. After every piece is finished being processed, labeled, bottled, and bagged, the technicians take their personnel sampling. To do so, a Rodak is taken of their hands to ensure there was no contamination present on their gloves. They will also test the work surfaces and air. The packaging technician will complete the batch record and prepare the processed tissues for final packaging and placement into the freezer prior to the lyophilizer for freeze drying. Prior to med cleaning, this is the appearance of the hard tissue. The technician begins the debridement process, switching on the med clean unit and inserting his hands into the glove ports. One hand manipulates the power washer spray gun, the other secures the tissue to be cleaned. A foot pedal is used to activate the power spray. After the med-clean process, the bones are almost completely clean, free of nearly all muscle, fat, and soft tissues. For the first step in hard tissue processing, the technician manually debrides the bone byproducts from the soft tissue process. The tendinous attachments are removed from the tibia using a sharp osteotome, giving the bone a clean surface for measuring and cutting. The technician first separates the ridge of the iliac crest and then takes measurements to ensure the blade is set correctly before proceeding to cut tricortical wedges from the crest. These wedges will become allograft bone used for vertebral fusion. The wedges are then stored on a sieve until they are ready for the lavage or washing procedure. The technician uses a pinch test to gauge the strength of these tissues to ensure they are not too soft. Because these tissues will be used in weight-bearing grafts, they must be of sufficient strength. If any kind of movement is detected when squeezing, they'll be set aside and used for grinding material. Here the technician sets up the bandsaw to the proper cutting length in preparation for cutting fibular shafts and wedges, which will be used for cervical and lumbar fusion and possibly for thoracic procedures. When complete, measurements are taken to ensure the pieces are within exact specification tolerances. The femoral head is debrided using a drill reamer and a femoral head cutter made especially for osteotech and specifically for this procedure. It allows us to remove the cartilaginous material without damaging the cortical surface. Upon visual inspection of the other femur, it appears to have had a previous fracture. Normally they are straight. Because it is compromised, we will not use that tissue for any weight-bearing graft. Instead, it will be ground and used for Grafton. The distal end of the femur is segmented piece by piece, exposing a large area of cancellous bone, which will be saved and cut into small pieces for use as cancellous chips. The undamaged femur is then segmented in preparation for being cut into femoral rings. In this femur, the technician is cutting a hemicondyle, leaving the left medial condyle intact. Some surgeons prefer to cut up their own grafts, so they request a whole piece. After segmentation of the femur, several femoral rings are cut from it. The cancellous inner portion of the distal end of the femur is now being sliced in a grid pattern. Several more well-placed cuts result in a mass of cancellous chips. The center of a femoral ring is drilled out in preparation to accommodate a cancellous plug, which will be inserted into the center of the ring. Here, a technician is cutting a cancellous plug from the distal portion of a femur. This dowel cutting system is custom-made for osteotech, designed specifically for plug or cortical dowel cutting. This plug is being removed from a distal tibia using an oscillating sagittal saw. The cancellous plug is inserted into the hole previously reamed in the femoral cross-section or ring, creating what we call a femoral cross-section with dowel, or composite cross-section. This gives us the best of both worlds: some cancellous material to help promote rapid new bone growth, and some cortical material for strength. Once the dowels are tapped in, the technician uses the bandsaw to square off and remove any excess dowel that may be protruding from the cross-section. This results in a nice, smooth, level surface. The outer edge of the femoral ring with dowel is fine-tuned, rounded out using the bandsaw, resulting in a smooth, symmetrical final product. The bone mill seen here will grind the material into any size required, from fine powders as small as 100 microns all the way up to 10 millimeter shards. We have several commonly used sizes that we grind down to, depending on what the client needs. Here, the technician is lavaging cancellous chips that were just produced to remove any lipids. He'll continue to massage and wash the chips until they have a nice, clear, marrow-free and blood-free appearance. Any pieces that will not come clean will be eliminated and used for destructive testing at the end of the process. Before the crest wedges are lavaged, they have a dark appearance due to the presence of blood and lipids. After lavaging using high-pressure water, but not high enough to damage the cancellous material, the wedges have a clean, white appearance. After soaking in an ethanol bath, all of the hard tissue pieces are fine-tuned. Each piece undergoes several methods of fine-tuning. For example, a high-speed dental burr is used to remove any excess tissue from the outer surface of this femoral ring. The burr takes off a minute amount of the bone, giving it a smooth appearance. Here, a fibular shaft is fine-tuned in the same manner as the femoral ring. The fibular shaft undergoes another fine-tuning using a small piece of Kirschner wire pulled down into the medullary canal to remove any excess tissue that may be present inside. A curette may be used for removing tissue that's a little more stubborn. Once the medullary canal is absolutely free of debris, the edges of the fibular shaft are filed to remove any minute bone fragments or splinters. Here we see an array of finished hard tissues produced from the donor. Before they are approved for packaging, the technician inspects, removes, and discards any dark pieces of cancellous chips that would not come clean. He then measures the volume of chips generated and records the measurement in his donor batch records. One technician gathers tissue samples for destructive testing, placing them into individual vials, while the other places an agar airstrip into the air testing canister. The bulk product is bagged and will be swabbed and quarantined. If deemed sterile, it will be sent back to the Corps for future processing for Grafton or other products. Before being bagged, the individual pieces are measured. As the technician calls out the measurements, his partner repeats the measurements and records them in the donor batch file. Then each piece is placed in its individual bottle or bag. Every single piece is swabbed with 2 swabs, which will be placed into 2 different types of media and incubated at different temperatures. Each bag, bottle, and tube is labeled with the donor number and serial number. The technician will check the number on the bag or bottle and match it up with the sterility testing tubes, ensuring that they correspond. The technician inspects each stopper before placing it on the bottle. If he sees any defects, the stopper will be discarded and destroyed. Once the stoppers are seated on the bottles, the whole tray will be placed in a sterile freezer set at -60 degrees Celsius. When completely frozen, the tray will be transferred to the lyophilizer to be freeze-dried. When the hard tissue processing procedure is complete, the tools, supplies, and equipment are evacuated, and all room surfaces will be cleaned and disinfected in accordance with clean room standards prior to a new donor being introduced. The air inside our core tissue processing rooms is changed more than 500 times an hour. It is taken up through returns in the room, sent up into a common plenum, and forced down through the ceiling, which is comprised of 0.2 micron HEPA filters. Prior to final packaging and labeling of the processed donor pieces, the samples undergo further sterility testing in the sterility test isolator. The technicians who work in the sterility test isolator enter a pressurized half suit entering from the bottom. The suit is disengaged from the hanger, allowing unrestricted ability to move throughout the isolator. In addition to testing processed tissue samples and their respective packaging, the technicians also test certain areas of the isolator, as well as their suits and gloves with Rodak plates, which will be incubated to identify any microbial content. Only after all sterility test incubation periods for the donor are complete and test results show the compliance of the product and environment, can it proceed to final inspection, labeling, and release. The water used in all our tissue processing procedures is generated on-site and tested at the beginning of every shift. It is run through reverse osmosis, then through a 0.2 micron filtration system, followed by a 0.1 micron ultrafiltration process. After distillation, the water is stored in a water tank at 180 degrees Fahrenheit to ensure no microbial activity. Prior to final tissue inspection and release, we X-ray certain long bones and develop the film in-house. The medical director will check for any identifiable cracks, breaks, flaws, or other histological defects in the bone. For final product inspection, the donor file is printed out and matched to its appropriate bagged or bottled tissue. The inspector visually checks each bottle for any flaws in the glass and any problems with the stopper. She also checks for tissue color, integrity, porosity, and if applicable, they'll check the measurement of each piece. When everything is deemed acceptable, they'll indicate in the tissue management system that the unit has been accepted and the product is given approval for final labeling and release. During final product labeling, a comprehensive series of redundant accuracy verifications are performed. This entails a visual checking of all labels against their respective donor batch files. All labels indicate donor number, storage parameters, expiration date, product code, and culture number. Irradiation status is also indicated. Electronic verification is also performed utilizing barcode readers linked to a computerized version of the donor files. This combined method of redundant visual and electronic label processing and verification helps ensure 100% labeling accuracy. Osteotec processes thousands of donors each year, resulting in tens of thousands of pieces processed yearly. To date, there has never been a single case of disease transmission reported with any of Osteotec's processed tissues. As far as base allograft, Grafton DBM, and soft tissues are concerned, we are approaching the 2 million mark without any reported transmission. With a history of clinical success and an impeccable record of safety, Osteotec stands at the forefront of the allograft tissue processing industry for transplant bone, ligaments, and tendons. Maintaining a global focus on both patient and surgeon needs, we remain committed to the continued development of new products and processes to improve quality of life for patients and quality of care by the surgeons.